Good morning. It's Catherine Watson here with Find Houston Senior Care. And I'm starting something new today. I'm starting Friday Facts because I know that there are so many families out there that are just struggling. They don't know what they don't know until they don't know it. And then they're usually stuck in a crisis. And I don't want to see that happen to you. So I want to give you some information out there. And this is National Hospice Awareness Month. Hospice has a really sweet spot in my heart. And a lot of people have a lot of misconceptions about it. They're really afraid of it. They wait until the last minute to call the hospice company because they think it means that they're giving up. And I want to clarify and help you understand a little bit about this service because it is awesome. It is the most amazing service out there. And guess what, guys? It's covered by Medicare. Yeah, there's not much out there that is. So when you find a service, especially a service as great as hospice, and it's covered by Medicare, why would you not use that service? So, and I think the reason why is because there's just a lot of misconceptions and misunderstandings about it. So let's try to clear that up a little bit. Some things that I hear from families is, my mom doesn't have cancer, so I don't think she can be on hospice. A lot of people still associate hospice with cancer, and I believe that's where hospice kind of got its roots with dealing with people with terminally ill cancer. But it's so much more than that today. Many of our elderly get wonderful benefits from hospice companies and hospice teams that go out to help them. Another misconception I hear is that hospice, I don't want to put my mom in a hospice. Well, hospice isn't a place, okay? Hospice is a service, and it can come to wherever you are, okay? So if you are at home, if you are in a nursing home, an assisted living, a personal care home, it doesn't matter where you are. The hospice team will show up for you where you are. And that's what I want to get into too, is that team thing, because there is no other medical service that provides a team approach. Think about it. Our medical system is pretty fragmented. You go to one doctor for this and another doctor over here for that and another doctor for that, and none of them really communicate most of the time, right? With hospice, it's different. You get a whole team that is assigned to your care and the care of your family. So it's not just about the patient either. It's about the whole family, taking care of everybody. They understand that when the family is feeling comfortable with what's going on and the family understands and is getting the help that they need, it's going to make it so much better for the patient, just so much better. So this team approach is unique to hospice, and I love it. I just love it. So let's talk a little bit about that team and who's on the team and what they'll do for you. So number one, you're going to have a medical director or a doctor, okay? A lot of people think that they have to give up any medical care at all. Not true, okay? If mom gets sick while she's on hospice, they will address the issue, okay? It's not like we're just going to throw you to the dogs and let you die. That's not what hospice is about. Hospice is about caring for everybody, caring for the person and giving them the best care possible, whatever that may be. So you will have a doctor that is assessing the situation, that will visit with you from time to time. But you'll also have regular visits from your nurse team. So you'll have a nurse or maybe sometimes two nurses because you may have a weekend and a night nurse. The day nurse can't work 24 hours a day, right? So you usually have a couple of nurses on your team that can help out. They come and visit to note any changes that are happening, address any issues that the patient or their family may have, any concerns that the family may have. A lot of times, especially with elderly people, towards the end, they may stop eating, refusing their medication, and it's very anxiety promoting for the family and for the care staff where they're living, and they don't know what to do about it. So the hospice team is there to help you walk through that. The nurses will come sometimes 1 or 2 or 3 times a week or more if needed. Again, the situation is constantly being assessed to see what is needed. The great thing is, too, the nurse is always available. If you think there's a big problem and you want somebody to come out and take a look at mom, maybe you're afraid she has another urinary tract infection, or her behavior has just changed totally, she's not responding to you, you pick up the phone and you call them and they're there. The way the hospice companies usually work is their nurses live close to where their patients are. So they can usually get there in a short period of time to be able to help. When my mother-in-law fell, she was living in an assisted living home, and she fell one night. In the middle of the night, doesn't that always happen? These falls never happen in the middle of the day. They happen in the middle of the night. And we get a call about 2 o'clock in the morning, and they're taking her to the hospital. And we were in a panic mode and getting dressed and rushing to the hospital. And about halfway there, I remembered, oh my gosh, we're on hospice. So I called my hospice company, and I said, look, they're sending her to the hospital. Can somebody meet us there? And they did. We got there about the same time the nurse got there. I mean, she was really quick, and she was amazing. Hospitals are so stressful to me. I don't know about you, but I hate hospitals and I hate emergency rooms. And I get very agitated dealing with the system. So having this nurse there to help us just made it so much better. She was able to communicate with the medical professionals in their language, okay? She speaks medical, I don't. That was awesome. That was great. So she was able to talk to them. She was able to talk to us. She was able to help us determine what we really wanted them to do. My mother-in-law had fallen and hit her head, and you know, did we want to have that head cut open at 89 years old in the frail condition that she was in? That was a decision we had to make, but she helped us to make the right decision. She didn't tell us what to do. No, absolutely not. She did not tell us what to do. It was our choice. But she helped us make the right decision. And then when we went home from the hospital, back to the assisted living, they were there with her. They were there with her. They were assessing her. The next day, I was supposed to be flying out to see my granddaughter being born, and I was stressed. I didn't know what to do. I didn't want to leave Patty Joe if something was going to happen. If she was actively dying right now, I didn't know what was happening, and I was scared. And the nurses were so wonderful. They went and they spent time with her, and they assessed her. I think the nurses were there for several hours. And at the end of it, they called me and they told me she's okay. Go ahead and go on your trip. She's going to be fine. She's not dying tonight. She's not dying tomorrow. You're going to be okay. You can go. And that was huge for me. That was so comforting to have that person on my team to help me. And, oh gosh. So I had, I forgot to put, when you're on live video, you should put your phone on automatic forwarding. You should forward your phone. And I didn't. So learning something new. Going back to hospice, though, your team approach is awesome. So you've got the doctor, you've got the nurse. They also sent in a caregiver to help give Patty Jo baths. And yes, the people at the assisted living could give her baths, but let's face it, there's not enough of them to spend the time that she needed with her. And this is a person that is dedicated to do nothing but come in and take care of my mother-in-law. And that was important to me. That was so important. Number two, this caregiver was fully trained in how to deal with people at the end of their lives. They understood how to deal with somebody who was extremely frail. They understood how to deal with the anxiety that my mother-in-law was experiencing. They went in the bathroom and they prepared the room, made sure it was warm, put aromatherapy in the room to help calm and soothe. They knew how to talk to her, to get her to respond to them, to make the experience pleasant for her. That was huge. So we've got a medical director, we've got a nurse, we've got a caregiver. And then we also have a social worker. Oh gosh, the social worker is awesome. The social worker is so helpful. They come and just spend time with your loved one and listen. They're such good listeners. And everybody wants to be heard, right? Especially somebody towards the end, because so many times everybody's telling them what they need to do and how they need to do it, and everybody's in kind of a panic mode. And the social worker strolls in and she's just calm, or he, it's just a very calm presence, and they listen and they allow that person to express their feelings, and then they bring that information back to the whole hospice team so that the whole hospice team can know what information they've gathered so that they can then do their job even better. It's an awesome approach. So now we've got a medical director, a nurse, a caregiver, a social worker, and you've also got a chaplain. And the chaplain was huge for my mother-in-law. He really met her spiritual needs, and I think that was something that was missing for her. So you've got a whole team approach, and it's awesome. Now, you don't have to have all of these team members if you don't want. If you are at a stage in your life where you don't need a caregiver to help you with bathing or anything, it's okay. You can say, I don't want that. That's fine. If you don't want the chaplain to come visit for whatever reasons, maybe you have your own pastor and you just want to talk to him. That's fine. It's okay. It's all about choices, and the choices are yours. That's what I love about hospice. Hospice is not about dying, people. It's not about dying. It's about living. It's about living life to the fullest, whatever amount of life you have left. My mother was on hospice for 1.5 years. My mother-in-law was on for, I think, about 7 or 8 months. Everybody is different. Yes, you have to have a diagnosis from the doctor that says that, in their opinion, you may have 6 months or left to live. But the doctor's not God, is he? No, absolutely not. The doctor is not God, and he doesn't know when you're going to die. Nobody knows that. So don't wait until the last 2 days to get hospice. Don't wait. Go ahead and talk to hospice today. Find out. Maybe mom qualifies, maybe she doesn't. The first time we talked to hospice about my mother-in-law, they came in and they visited with her and they assessed her and they said, she's not appropriate for care yet. She's not there. But that we would pay attention to what was going on with her. And if we noticed changes, then we would be able to have them come back out. And that's what we did. So a few months after that initial visit, maybe 5 or 6 months later, hospice came out again, and this time she was appropriate. and we got the services, and the services are invaluable to the family. I mean, I told you about what happened when we went to the hospital. That's just one example. When my husband and I started seeing big changes in her behavior, we called the hospice company and said, can we have a meeting with the team? We're really concerned. We're worried. We don't know what to do. We don't know how to best help her. Can you help us? And they did immediately. They set up a meeting. We went to their offices. We sat down with the nurse, with the social worker, with the chaplain. We sat down with the team and we talked about what was going on, what we saw, what they saw. We talked about her medications. Should anything be changed? How could we change it? What can we do as a family to help her to be more comfortable? What can we tell the assisted living facility where she's living? How to best deal with her behaviors? It was invaluable. I just cannot tell you enough about the value of this. And guys, Medicare pays for it. Okay, I want to shout that out because Medicare pays for this service. It's so important. How many services out there does Medicare pay for? Not a whole lot, okay? It doesn't pay for assisted living. It doesn't pay for your nursing home. It doesn't pay for a lot of things, but it does pay for hospice care. Why would you not take it? Why would you not accept it if you qualify? I just cannot imagine that. Except that I know that a lot of people just still have a lot of misconceptions. They think that hospice is giving up, okay? It's not giving up. It's being smart and saying, I want a different way. I want to live out the rest of my life happy and comfortable and doing what I want. The hospice team is there for you to help you or your loved one live out the rest of their life the best way that they can. So I implore you, I ask you, I beg you to just take a moment, take a little time out of your day, call a couple of hospice companies. You can find a list of different companies on Find Houston Senior Care. There are several that I really like, but it's a very personal situation, and each hospice company has a little bit different philosophy maybe, or a little bit different way of doing things, and it's really about who you feel most connected with and most in alignment with. So interview a couple of them. Don't interview 50 because you'll just drive yourself crazy. But talk to 2, 3 at the most. Find out what kind of services they provide, how they provide their services. Find out where you can, how you can get your loved one assessed, and what kind of criteria should you be looking for that would mean that you qualify or your loved one qualifies for this service. So reach out today. Go ahead. Get online and Google hospice companies, or go to Find Houston. Better yet, go to Find Houston Senior Care, because we've got the ones right here in Houston. And just find one, connect with them, and move forward. That way, if you don't qualify for hospice now, it's okay. You know who to call when you're ready. When the time comes, you want to be prepared. You don't want to be scrambling trying to find the best solutions. So hospice is just an amazing service. I cannot say enough good about it. And you have the right to choose. I want to bring up this point because I was speaking at Texas A&M convention last year, or actually this past spring, and a question came up in the audience, and I just went nuts about it. And I want to address this again. Somebody in the audience asked me. They said, "Catherine, does a hospital have the right to tell you which hospice company to use?" No, absolutely not. If somebody, anybody, a social worker, a case manager, a hospital, if somebody, a doctor, a lot of times doctors are associated with a hospice company, and they may try to direct you to their hospice company. Now, I'm not saying that their hospice company is or isn't a good hospice company. It may be the best choice for you, but it's your choice. And you shouldn't feel pressured. And if anybody is making you feel pressured to use a certain company, run the other way, okay? Because something's wrong there. They should never be making you feel pressured to use a certain company. So remember, it's your choice. You have the right to choose, and you should look at least 2, maybe 3 hospice companies out there before you make your decision. Do what's right for you and your loved one. Do what's going to be best for y'all. A few more things I want to say before we leave about hospice. Hospice does a lot more, okay? We have this great team approach that I talked about, but they just pick up the ball and run with it when somebody comes on service. For instance, with both my mother-in-law and my mom, they immediately addressed the need that they had. Both ladies had severe arthritis and were in constant pain. And they immediately got a hospital bed in with an air mattress so that it provided a level of comfort to these ladies. And oh my God, that made me feel so good. We didn't have to pick up the phone and call companies and find out how to do this. They took care of it for us. They took care of it, and Medicare paid for it, and we didn't have to worry about a thing. With my mother-in-law, they also brought in oxygen because they felt like that would help her. That was awesome. They do everything. They also take care of the medications. They'll pay for most of your medications. Yeah. Did you know that? Hospice will take over the medications and they will pay for most of them. Now, that doesn't mean that you don't have a say, okay? You still have a say. It's your choice. Some medicines may not be covered under hospice, and you would then still have to pay for those, just like you have been. But most of them, or a lot of them, will be covered. And that's huge for families who've been struggling to pay for all of this stuff. Another thing that they provided for us was they provided the Depends that Mom needed, and the Depends that my mother-in-law needed, and the diapers that my mom needed. That costs a lot of money. If you haven't had to buy those things, oh my gosh, you're going to be really surprised when you do. They're not cheap. So all of these things helped her and helped the family. And I just can't say enough good. So get out there today, start exploring hospice, understand a little bit more about it, and get that service when it's time. Get that service. Don't wait till it's too late. Well, it's never really too late, but you just don't get as much benefits if you just take hospice the last 2 days. You get so much more benefit when you have them on for several months to help walk you and your loved one through this journey together with a team approach. I'm Catherine Watson, and we're going to be starting Fact Fridays every Friday and try to help you learn a little bit more about how to navigate this